I just joined myself a few months ago. So
Awesome.
my first question is, what influenced you to become a chiropractor?
Oh, sorry, you kind of cut out there. Did you say what made me want to be a chiropractor?
Yeah. What influenced you?
So I started going to a chiropractor when I was like 6 years old. And that was our first line of defense when it comes to anything medical. So grew up in a more holistic household. My parents' really good friend was a chiropractor in our town. And I knew I always wanted to be in the health field. And he just really influenced me. I was just like, he loves life. I would be at his office. Everyone would be happy. And, you didn't have to see anyone like bleed out or anything like that. So I knew that being a doctor of chiropractic would be, working with the body and its innate ability. And that just is something I truly am passionate about and believe in.
What's your favorite chiropractic technique that you've learned?
I use mostly diversified, and then I also use an Arthrostim. So I like to do correction. So I like to re-x-ray my patients every, 3 to 6 months and make sure we're making improvement structurally. And then, that just really shows the patient, how much chiropractic can change. I like to compare it like putting braces on somebody's teeth.
Right.
You can't brush your teeth straight, just like you can't just stretch and hope to get a better correction. So I love diversified with Arthrostim.
Can you explain what is it? What is it called? Orthostim?
Arthrostim? Yeah. So Arthrostim is a tool that basically is just really, really specific. It's also really great for someone that is like fearful of a manual adjustment, specifically in the cervical spine. So I was trained on that years ago when I was doing my residency up in Chicago. And it's just really specific. I've even gone to Dr. Wogan's office up in Minnesota, and he's like the founder of the Clear Institute for Scoliosis.
Yep.
And he actually shows patients getting adjusted with digital motion x-ray and how the Arthrostim tool can actually move specific segments. So it's really, really specific. And it's great for people that have a fear of manual adjustments in the cervical spine.
Is that different from the Activator?
Yes.
Huh.
It is different. Mm-hmm.
Huh. Do you have one there with you?
I do, in the other room. If you want to
go grab it?
Yeah, I'll go grab it. Hold on.
Oh, I want to see this thing. Huh. Oh.
So this is an Activator, and it clicks. I don't have it plugged in.
Is it pneumatic?
It clicks, and you can just be real specific. You start a patient in flexion, and then you go from the side like back here, and then into extension. And then you can also do like lateral. So like if a person's atlas goes lateral to the right often or to the left, you can go straight on there. And you can actually watch the vertebrae move into alignment on digital motion x-ray, but I don't have that because it's like crazy expensive.
Is that machine, so you just plug it in, or is it pneumatic?
Yeah, it's a plug-in. Mm-hmm.
Okay, cool.
And it like clicks. Here, let me plug it in. Now I want you to see it.
Oh yeah.
Yeah.
Cool.
Yeah.
Very cool. So while you were out of the room, I was saying I've been here for 4 or 5 years. I've been going to chiropractic since I was 4. That's the first time I've ever heard of that.
Yeah, no, patients love it, and it moves stuff. I say it's like a jackhammer for the spine.
Well, don't scare me now.
But it doesn't hurt. Come on, you're fine.
No, I've had the Activator method done, but with a pneumatic one, and so it's kind of scary, right? You got this tube coming into the thing, and it's kind of scary, but it works. So yeah. All right, Ashley, take it away.
That was actually
all the follow-up questions, apparently.
What's your favorite thing about working with your patients?
I love seeing patients, like, just especially my favorite thing is skeptic patients. you know, they've done everything. They've never been to a chiropractor and they're like, I don't know about this. And then, you know, after like 1 or 2 adjustments, they're like, whoa, I can totally move better. And you're like, yeah, this has been around for, you know, over 120 some years. Like, it actually works. And then diving in deeper and then teaching them the importance of getting adjusted. You're not just feeling better, but you're healing better. And, you know, teaching them the nervous system controls everything. And, you know, it's not, you know, a coincidence that you're healthier once you start getting adjusted.
Yeah. Yeah.
I love that. And I just, you know, I've really gotten to know patients. You know, my clinic's been open it'll be 10 years in March.
Oh, wow.
And I have patients that have been with me for 10 years and their children get adjusted. I've gone to hospitals to adjust babies. It's just truly a blessing to be a part of their family.
That's awesome. Yeah. I was reading about Palmer earlier today, actually, and how his first adjustment was on, I forget the name of the guy, but
Harvey Lillard.
That's the guy. And he lost his hearing. Yeah. And he started getting adjustments, his first adjustments ever from Dr. Palmer, and got his hearing back.
Yeah.
It's wild. It's wild. Everything's connected.
Yeah. It's true.
It's awesome.
So kind of leading into my next question, what do you think is a popular misconception around chiropractic care?
Probably, you know, I hate the term quack, but like, you know, that was planted in like medical schools in the 60s or 70s, the whole documentary on it. So, you know, that chiropractors aren't real doctors. And, you know, when you start to tell patients, you know, actually, if you compare medical school to chiropractic school, and you're just talking about the initial degree, we take more hours than medical doctors do. Now, that's before they obviously go into their specialty and what they focus on. But, you know, they don't realize how many hours of, you know, studying and boards and everything like that. So, you know, that we are legit doctors and, you know, you have to pass rigorous boards, you know, to get that license. And but yeah, that, and also another thing is that, you know, like, oh, should you get adjusted, you know, for the rest of your life? Well, the answer is yes. If you want to be healthy, you know, it's like, you wouldn't just go to the gym, you know, a couple times a year if you're trying to achieve like peak physical performance. It's a lifestyle. And just like people are taking vitamin D and C and zinc and everything right now with COVID, you should probably be getting adjusted on a regular basis. Not probably, you should be. Because that's your number one defense is your immune system. So our offices should be flooded with people right now.
We're getting there. We're getting there, Dr. Gaby. Yeah, I apparently did some reading this morning. I don't even know where I did this reading. I was reading about something chiropractic related, and I read that the amount of school that chiropractors go to, if you put all the hours back to back on study and hands-on, it's like 175 days or something like that. It's an insane amount of time.
I don't think I could do it again.
It's a good thing you're done.
Yeah, exactly.
Well, you're done and you have your own clinic. So what made you want to open up your own practice?
You know, I don't know. I guess I like a challenge. Sometimes I wish I didn't, you know, and I also just knew that I wanted to, you know, just, I guess, do it on my own, you know, and I know this is cheesy, but being a woman in a very dominant male field also kind of maybe gave me a little nudge of like, you know, if they can do it, I can do it too. I don't know. I'm Italian. I'm strong-willed. I'm stubborn. I mean, I work until we get it done. So I think there's a reason why the clinic is still open almost 10 years later, when otherwise other people would just shut down.
What's so you were New Heights and now you're Backfit. What's the name about New Heights? Is that the area there or?
There's a town neighboring O'Fallon called Fairview Heights.
Okay.
And then, so like when I was opening up, I had like a mentor saying like, you should do something, related to the town or nearby town. And one of my best friends in chiropractic school, she was a mentor to me. She was a couple years ahead of me, and she opened a clinic, and it was called New Life Chiropractic. And I was like, oh, New Life, that's awesome. And then I was like, oh, Fairview Heights, patients reaching new heights of health. So that's why I chose that.
Got that double entendre going on there. Yeah. It's good. So now you're part of BackFit, and I assume this is actually his next question, or close to our next question. Go ahead.
Sorry, you froze.
Sorry. It's all right. What is your proudest career achievement that you've reached, and why?
I don't know. I mean, I would say just being open this long is a huge thing. Like literally in the next 2 months, it'll be 10 years. And I think that is something that I don't remind myself enough, that I have done it on my own, up until this point. Obviously I had mentors and stuff like that, but that's a big deal for a small business. And I was able to go to the Olympics in 2012 as one of the chiropractors. That was pretty cool.
Do you have a patient story that you really like and you can share with us?
Little things like I love the fact that somebody will come in and they have no idea about how much the nervous system controls everything, and they'll start getting adjusted because they initially had headaches or low back pain, and then all of a sudden they'll say, I haven't taken any of my heartburn medication in a couple weeks, or and I'm like, well, it's all related. Or I love when patients get off medications, especially blood pressure medication, obviously with not consulting their doctor who prescribed it, but getting off medications is one of my favorite things of seeing patients. Or I have a patient that has 3 children, and when she started under care with me, this was 9 years ago, she was told she would never be able to conceive. She went to multiple specialty doctors, and now she has 3 kids, and she literally jokes around and tells people, Dr. Gaby got me pregnant. I was like, let's edit that, but yeah.
That's great. That's really awesome.
Yeah. So you've obviously had your mentors, you've had your people that you have helped guided you to get where you are today. And so if you could give any young person that's looking to become a chiropractic doctor any advice, what would you say to them?
I would absolutely say to them that having mentors in both as chiropractors and then business advocates would be really important. And, not just taking, learn from the best. I truly believe in coaching. And so if you want to be the best, you shouldn't be learning from somebody that's struggling through it. So, that's one thing why, I'm so happy to be part of BackFit. My husband and I went out to visit after Dr. Hedges introduced me to Dr. Roddy, and we went out and I was like, whoa, Clark, that's my husband. I was like, dude, this is legit. This is legit. And if I'm going to become a part and go through all these changes and everything like that, it's to take it to another level. And you're not going to do that with somebody who, is just, struggling to get by, or is just kind of made it. And that's one thing that drives me right now. It's a lot of work right now, transitioning from New Heights to BackFit. But it's, you see the light, and that's why you work hard.
Yeah. Well, we're really happy to have you on board. We're growing quick, and it's important to have people as passionate as you involved in this. So I'm really happy to have you.
I'm happy to be part of the crew. I wish I had that weather there, though.
I don't know what you're talking about. This is off. This is not why I live here. This is terrible. All right. Do we have any more questions, Ashley?
We have 2 more questions.
2 more?
Okay, let's do it.
All right.
So obviously BackFit, we love our integrated care. And what do you think is the greatest advantage about having all of these medical professionals under one roof?
Because so can be like a one-stop shop, and truly the patient gets the best experience. I truly think like every time I go into a doctor's office, whether, like I took my husband, he had to get a surgery a year ago, or I go to my dentist, or, I take my little sister to her, neurologist appointment. I'm constantly looking at how the staff integrates with the other patients, how the front desk greets you, et cetera. And even just from going out to visit you guys out in Arizona to how I am with my staff, how we treat our patients is so much better. It's more personable. And when a patient can see, meet like the girls at the front desk, or, that therapeutic exercise tech, or the nurse practitioner, PA, whoever, the chiropractor, like you're forming relationships, and it's all under one roof, and you trust those providers. And I think that's really important. And having that integrated role, and knowing that we're communicating too. So it's not just, just me, Dr. Gaby. I'm also talking with Shannon, my nurse practitioner, and saying, hey, Bill came in this morning. Did he tell you about that? And we're talking about the patients, and we're putting the patient's interest to the highest,
Yeah. Yeah, it's one of the things that first impressed me when I walked in as a patient, was that they knew my name. It was like instantaneous. Like, hey, Zach, how you doing? And all of them knew, right? They were all like, oh, Zach's coming in. I'm sure they talked about it before. Zach's coming in. He's doing this, that, and the other thing. Here's this card. Let's treat him right. So. Yeah.
So my last question. Obviously, behind chiropractic, there's a lot of disbelief and a lot of myths going around. Are there any myths that you would like to debunk?
You mean regarding chiropractic?
Yeah.
Probably the biggest thing would be like stroke, which, it is a risk, but, you have the same risk as, getting your hair shampooed and at a salon, in that extension. So, I mean, yeah, there's risks in everything, but there's also risks in taking ibuprofen. There's risks in, every single prescription that you take, and higher risk actually. And then I guess another, so it's like 1 in 10 million is the risk. You have a lot greater chance of having an adverse reaction to over-the-counter medication or a prescription that you're taking. And then I guess another thing is like you have to continue going for the rest of your life. No, but if you start to feel better and you're healing better, it's like, why wouldn't you?
Yeah.
I'm not saying you need to get adjusted 3 times a week for the rest of your life, but, maintenance and wellness is, everything. And how you treat your body now is how it's going to treat you later. So.
Yeah.
Fair enough. That's we have more time if you have more that you want to tell us. You want to tell us your life story? It's only 1:20.
I don't think you want my life story. One thing that I knew I wanted to be a chiropractor since I was I thought about it in junior high and high school for sure. I knew I wanted to. So I did go on to St. Louis University undergrad and was pre-med, but got my undergrad degree in nutrition and dietetics because I think it's important to counsel patients on nutrition.
Yeah.
And that's one thing that's really cool. Having a nurse practitioner here is now doing all those labs, especially like food sensitivity and micronutrient deficiency. So being able to really bring like a total wellness package, and not just guess, but you test and figure it out. So I love that. That's one really cool thing I am excited that we're doing now in the clinic.
Awesome. What are you bringing in next? Because I know we have a lot more to bring to you. What's the next thing that BackFit is bringing for you?
So we're going to start the labs. We have some of the DME implementing the rest of it. And then Dr. Jake is actually supposed to come out next week, I believe.
Oh, nice.
And he's going to really help on adding more of the therapeutic exercises. So like the PT. So we just put a TRX and
Nice.
rip trainer in. My handyman is my husband. He's like installing stuff. He doesn't even realize it. But yeah, no, and I think down the future, we're going to do decompression, things like that.
Awesome.
Yeah.
Do you have anything else to add?
Me or Ashley?
You. You're the doctor.
I'm just a person. No, I'm just excited. I know my team, we felt, overwhelmed at first, but every single day is getting more streamlined. And I feel like every day we're just, becoming better. And that's how it should be,
Yeah. Well, you let us know if there's anything that we can do over here for you. Ashley, do you have any more questions?
No, that's all I had. Thank you for taking some time with us.
Of course.
Yeah. We thought this is the first time we've done this, and we thought it would be a really, really fun thing and a cool thing to do to introduce you to everybody. So.
Yeah. Awesome.
All right. Well, thanks for joining us.
Oh, no problem. Thanks for having me.
Until next time.
All right, you guys.
Talk soon.
We'll talk soon. All righty. Bye.